Hello and welcome. Thank you for watching my presentation. My name is Michelle Morgan. I'm a Healthy Communities Officer at Public Health Services in the Tasmanian Department of Health and also a PhD candidate at the University of Tasmania, supported by the Australian Prevention Partnership Centre. Both my work and research are concerned with place-based approaches to chronic disease prevention, and in the past few years I've been exploring how systems thinking can be used for chronic disease prevention and the role of local government in this space. The aims of my presentation are to share survey results about the local government sector's perspective about their role in community health and wellbeing in Tasmania, and how local government councils in Tasmania collaborate using social network analysis, and to consider if local government could be the game changers in chronic disease prevention and why. First, I wish to acknowledge the Muwinina and Palawa people in Tasmania, who are the traditional Aboriginal owners and custodians of the lands where my work was undertaken. I'd also like to acknowledge my supervisory and research team, colleagues at Public Health Services and the Local Government Association of Tasmania, and the study participants for their support. I'd also like to acknowledge the Australian Prevention Partnership Centre, who provided funding that enabled this study. There are 4 parts to my presentation. The first is why the research is significant. Then I'll provide an overview of the survey. Then I'll share the results in 2 parts. The first is the participants' perspectives on community health and wellbeing. The second is about collaboration. Then I'll share why I think these insights matter. Tasmania has the highest rates of chronic disease compared to other Australian jurisdictions. And in Australia, it's estimated that 38% of these diseases could be prevented by reducing exposure to modifiable risk factors and addressing the social determinants of health. Local governments are well placed to respond to local health and wellbeing needs, and internationally are doing more to address these needs. In Tasmania, however, controversy exists about what local governments' roles in health and wellbeing entail. Systems thinking and collaboration are proving to be integral for more effective responses to complex health and wellbeing issues, but it is not known how Tasmanian councils work together or on what, or the sector's awareness or receptiveness to systems thinking. A statewide survey of local government personnel in Tasmania was conducted. There were 3 parts of the study, which explored the sector's perspectives on community health and wellbeing, which included systems thinking, collaboration using social network analysis, and lessons from COVID, which I won't cover in this presentation. The survey was conducted online in late 2020, and general managers, council staff, and elected members were invited to participate. 135 people responded to the survey from 28 of Tasmania's 29 councils. 53% of participants were council staff and 47% were elected members. Staff who responded had worked for council for almost 9 years. Elected members had been elected for an average of 7.7 years. Based on the definition that community health and wellbeing refers to improving the health of all or smaller groups of people within a local government area rather than individuals, participants were asked if their council prioritised improving community health and wellbeing. 86% of participants said their council probably or definitely prioritised community health and wellbeing. And while a direct comparison is not possible, a study undertaken in 2011 found that only 36% of participants from local government in Tasmania agreed that health promotion was part of their core business. This suggests that there's been a significant shift in the sector's attitudes to what their role in health and wellbeing is. In our survey, it was also estimated that across 18 councils, the total number of full-time equivalent employees that work in roles that contribute to health and wellbeing is over 70. Participants were invited to rank where their council would benefit from more support to help improve community health and wellbeing. And their 3 top responses were finding more funds, encouraging more collaboration, and having a mandate for health and wellbeing action in legislation. Participants were also invited to rank the most important contributions their council makes to improve community level health and wellbeing. The 3 top responses were the provision of physical infrastructure, such as meeting venues, sporting facilities or playgrounds, facilitating community connections, and the provision of paid staff to lead or contribute to initiatives. Systems thinking was defined in the survey as offering a way to engage with complexity of health and wellbeing issues to help make sense of how things are related, how they work, and where you might start to make a change to get better outcomes. We found that participants' awareness of systems thinking varied from very aware to not aware at all, and that there was a high level of interest in learning more about how systems thinking can be used to address complex community issues. In the second part of the survey, we asked questions to enable a whole network analysis to be done to find out how Tasmanian local government councils collaborate with each other, which could offer insights that could be leveraged for prevention. In Tasmania, we have 29 councils across 3 regions, which can be seen on this map. Council staff were invited to answer questions about the type of work their council did with other Tasmanian councils across 7 different types of relationships, which were which councils their council had contact with for any purpose other than statewide meetings, which councils their council shared information, resources, and funding with, and which councils their council did different types of joint planning work with. And we had a response rate of 93%. We analysed each relationship separately using specialised software. For each type of relationship, we looked at various network measures to understand the structure of the network. What we found was that from the contact network through to the joint funding network, the relationships were progressively less dense, less connected, and slightly more centralised. This progressive decline is likely to reflect the more demanding characteristics of these relationships. For example, it's much easier to share information between organisations than it is to share funding. This network diagram is the contact network, which was the most dense network. Each dot represents a council, which are called nodes, which have been coded according to its geographic location based on the state's 3 regions, and the lines represent the relationships between councils. The software used to create the diagram automatically positions the nodes based on where there are the strongest ties. What we can see here is that regional clusters amongst councils have been revealed. That is, councils tended to work with other councils in the same region. Regional clustering was found in all networks that were measured. For comparison, this is the funding network, which you might recall was the least dense network. Again, what can be seen here is strong regional networks, meaning that councils tended to share funding with other councils in the same region than councils in other regions, except for one Northwest Council. Because of the distinct regional clustering, we did separate analysis for each of the regions, which revealed each regional network was denser than the statewide network, and councils in the Northwest were most closely connected to each other than in other regions. The structure of the overall network highlights the strength of the relationship between councils at a regional level. While councils do work with other councils across regional boundaries, they are much more likely to work with councils in the same region. So attitudes about local government's role in health and wellbeing in Tasmania appear to have shifted substantially in the past decade, and health and wellbeing is now prioritised. There is evidence councils are investing in health and wellbeing beyond traditional environmental health and physical infrastructure. And councils want to do more to improve the health and wellbeing of their communities, but want more support to do that, and identified funding, encouraging more collaboration, and having a mandate in legislation as ways to do that, which suggests an eagerness for councils to increase their role in health and wellbeing. So among participants, there is a sense of untapped potential within the sector to contribute more significantly to fostering community health and wellbeing. Given their distinctive features that include decision-making on factors that affect the social determinants of health, their existing networks and local knowledge, skills, and workforce, with additional support from other tiers of government and communities themselves, local governments could be game changers in curbing the prevalence of chronic disease. And there are many opportunities to optimise their contributions to community health and wellbeing in Tasmania. The network analysis revealed regional infrastructure between councils that could be strengthened for collaboration, which could have many benefits, such as reduced duplication of effort via information sharing, economies of scale for resource sharing, stronger relationships between councils, and better community outcomes. Other opportunities include improving funding models, strengthening a mandate for community health and wellbeing in legislation, and building systems thinking capacity. In the next stages of my research, I'll be exploring some of these ideas further to get a better understanding about what they might look like in practice. Thank you for listening. Please get in contact if you'd like to discuss what you've heard today further.